Thanks, everybody. Program Director, and it's great to be here. We're 20 years into democracy in South Africa, so we're still learning from colleagues like Thailand, Brazil, and other countries. So it's great. I unfortunately couldn't be here yesterday, and I'll be leaving today at lunchtime. So I thought I should save on the carbon footprint by next time doing Skype. But anyway, when the Institute of Medicine calls, as Patrick knows, I served on 2 of the previous panels, and it was just great. I think the convening power of the Institute of Medicine is great, so I thought it was important to come in person. For those of us that have been working with workers in general, particularly workers in the informal economy in particular, the convening power of groups such as the IOM or the Lancet, Harvard University is very important, because these are populations, as you've heard yesterday, on the fringes of society, very vulnerable, very weak. They organize, but it needs the enabling mechanisms of the more powerful in society that actually bring their voices to the table. And what IOM has done has actually brought the voices of the informal workers to the table. So we appreciate that together with the WHO. So I'm going to talk about some of the experiences that we have in South Africa. As I point out, we're a young democracy, so we're beginning only now to start tackling some wider aspects of society as we transition forward. The HIV/AIDS pandemic, of course, hit us quite badly. But we're getting above that now, so moving into the next steps of the process. So I'm going to quickly touch on the context, talk about a bit on the workers in the informal economy, and ultimately the interventions. So this is South Africa for those that have visited. It's quite an interesting country on the continent. Nigeria has just overtaken us with GDP figures, but that's a discussion that's taking place in terms of who's who in terms of leadership, and we do appreciate that there are other parts of the continent that also have greater economic power. But essentially what transformed South Africa's economy was the mining industry. And I'm hoping at a later stage to discuss with colleagues at the IOM about how do we look at resource-led economies and begin to look at the legacy of resource-led economies and what the consequences are for, particularly in our case, mine workers. And ultimately, as we got an oil and gas boom in the continent as well as mineral wealth, Africa for the 21st century is a resource-led economic-driven economy. But we don't want to have the legacy of 150 years of the problems we've had in South Africa with silicosis, pneumoconiosis, and a range of those other issues, TB with silicosis. But we'll discuss that some other time. So I'm hoping, Patrick, that we could discuss some convening in terms of the work we do together with the African Academies of Science. So we have 53 million South Africans. We face what's called the quadruple burden of disease, which is typical of many of our countries, unlike countries north of South Africa, which is still infectious disease. So we have the wide variety in transition, including environment, occupational injuries, road traffic accidents, cardiovascular, etc. Of course, we did the first heart transplant in 1968. It took us a political struggle to win over the hearts of people, but that's a different debate. We have 17 million workers in the country, and 4 million work in the informal economy. So unlike countries north of South Africa, where 90% of the economic generation is done by workers in the informal economy, South Africa has 1/3 of the workers in the informal economy. So we have 2/3 of the workers where you can attach a tax number to. And our South African Revenue Authority is similar to the Inland Revenue Authority of the US. I think they learned from each other. We think we learned from y'all, actually. I wouldn't hazard a guess to say your IRS learned from us. But we have quite a powerful South African Revenue Authority. So where you can attach a tax number, we have 13 million workers. Of particular note is the issue around migrant and cross-border workers, because often migrant and cross-border workers, and I'm sure it's the same. I saw an interesting presentation the other day on learning from the Mexico-United States cross-border issues about trying to document the whole issue around underground tunnels and a range of the issue around casualization and the informal workforce. And often we forget when we talk about the informal workers, there's another category of people that actually fall into much more vulnerable groups. And within South Africa, it's been a known issue in terms of farm workers, domestic workers, etc., that are cross-border and migrant. So it's very, very unique for South Africa. The other major problem is often, unfortunately, related to the International Labour Organization and the WHO. Many of the policy pronouncements and the legislative instruments that we have cover workers in the formal economy. So we tend to define things like health and safety representatives. So 1 to 50 workers in a formal workplace. I'm sure you had the presentations yesterday which discussed what is it when we have the worker in a home working on the floor making kites. What is the workplace? What is the workplace for the street trader? The minibus taxi drivers and the hawkers. So what is the workplace, and how do you actually come about setting up these things. So legal instruments have not gone further, and that's part of the issue that I'll talk about later on, about an agenda for change, that we have to work at multiple levels of the policy dialogue forum. And then social protection, of course, does not even come into. Social protection we're referring to is in terms of compensation systems, unemployment insurance fund, pension and provident funds, etc. And the tragedy of the system is that while we have a social security net in South Africa, very unique, 15 million South Africans are covered by a social security net. These are what we call poverty alleviation type processes, like a child support grant, pensions that are means tested, persons with disabilities that can access various social grants. So 15 million South Africans access those grants now. And it's done a lot in terms of cash transfers to poor families. We have some other models in the system, like there's amount of electricity per month that's given free of charge to households. Water is given free of charge to households, and we do have a housing policy. So within that overall social security net, but the key problem that faces the street trader is that although you have a free primary healthcare service that they can access, but the day that the street trader leaves the place of work means that the street trader loses income for the day. So unless workers in the formal employment, where we have 30 days sick leave in a cycle, so your sick leave is covered by a negotiated settlement between yourselves and your employer. And I'm sure workers in the United States have those protections as well. The street trader who leaves the job to come in and stand in a queue in the primary healthcare setup, although free of charge and not able to pay any user fees, will unfortunately lose a day's salary. So invariably, they do not select to come into the system until they are very sick, and that's when they will then come into the system. So there are important issues when you do design social security nets about how do you actually start looking after the informal sector and inputs around that. And we'll talk about that just now. Our labor market in South Africa is quite interesting. It's made up of formal and informal, as I talked about, urban and rural. And if any of you saw a tragedy that we had about the mine workers, in 2012, about 34 mine workers got shot. And I had to manage the process, of course, on behalf of my minister in terms of the postmortems. So it was a shock to our democracy to say that in a democracy like South Africa in this day and age, that you actually had workers being shot. We were actually asking for $1,200 per month in terms of their earning power. We had farm workers, by the way, asking from $6 per month to go up to $12 per month, farm workers. You know, the wine that you drink and things like that from South Africa, these were farm workers asking for that process. And in return, they were shot. So these are the tragedies. But part of the issue around that was the whole issue around modern and traditional, organized and unorganized. Some of these workers believe that you could spray a certain substance on their body that the police will, when they shoot them, the bullets won't actually come into their body. So it was quite fascinating in terms of some of the stuff that's taking place right now in terms of the inquest proceedings. There's a special commission of inquiry, and these are some of the issues that are coming up. So you have a very modern economy in South Africa with nuclear power stations, the largest coal power station in the world being built now in Medupi. But at the same time, you have workers who are very traditional in their approach. So part of the issue is part of the issues that we try to juxtapose about how cultural values and education systems have not kept in touch with the issues around what is the social milieu in which we work as we continue these processes. And the other unfortunate part is that the trade union movement, by far and large, Francie Lund, my colleague here, has long worked with Pathon with the trade unions. And unfortunately, when you become an ex-worker or a worker in the informal economy, you are not covered by the trade union movement. And I think that's some of the tragedies. It's only the current group in the workforce that are covered by trade unions. But outside of that, when you become an ex-mine worker, nobody actually cares for you. So it's quite fascinating as we go forward to start beginning to look at these organized sectors. So we have high unemployment, around 25% to 31%, depending on which statistics data you'll use. There's a concept of underemployment, where people actually go from one job to the other and this thing. And generally, there's a 50-50 split in the informal sector in the country, and they make up 34%. Of course, there's a big discussion about the insiders versus the outsiders. So that's the whole issue around the organized trade union movement that works very closely with the organized employment sectors and begins to be a barrier to other people coming into the system. So it's fascinating new models about union dynamism in South Africa and how come at some times that you protect your turf against others from coming into the system. So I think you spent some time on this. There's some issues around traders rather than producers. What we talk about, you've got your slides about own account workers where people make stuff. Many of our workers in South Africa in the informal economy, essentially, they trade. They buy and sell. Of course, the barriers to entry are problematic. How do you support credit for which bank will support you in terms of being an informal trader? And crime. Crime is a general problem in South Africa, but particularly for the traders themselves. But sometimes you have what is called organized crime, where the police will actually come and take away a whole lot of street traders and prevent them from trading on it. So fortunately, colleagues like Francie and them and WeGo have been working quite closely in terms of legal instruments, because we do have a very good constitution in South Africa that promotes and protects the rights of people, including street traders. And fortunately, those have been some of the things taken up. The GDP value, the informal sector is worth $30 billion. So, when you talk about the bottom half of the pyramid, so often we forget that there's this a very dynamic group that's working at the bottom half of the pyramid in pulling together, and these are some of the work that they work in: retail, transport, construction, subsistence, agriculture, etc. Of course, you know about all of the conditions. WeGo had a special workshop in 2011 where they brought people together from the informal sector and they asked about the various things. And often these are kinship, social, and personal groupings that come together that actually work together. Tough and risky conditions and the fight for survival. Some of the characteristics: it's more likely women and never married, often children under 7 years of age. Now, as I talked about the social protection net that we have of child support grants, there's a range of disability grants, etc. So these are some of the grants. Francie, of course, is the expert, having worked in social protection for many years. And I think this is an important part of the South African economy, about promoting and protecting people in general, poor people. But the key area is, of course, I think people don't want to just live on grants. I think there's this myth that people want to live on these handouts from government. I think people want to find, and this is the work that Laura and them have done, which is actually to start coming into the issue. Diversity is quite important, and you'll hear from other colleagues as well. So it's a similar thing about home-based workers, street vendors, beauticians, and hairdressers. So where its barriers to entry are very low, you can actually set up a small hairdressing thing, get a battery, and then start tripping air on the street. Now, in terms of the data, so at the moment it's anecdotal. So we don't have the kind of epidemiological studies to be done in terms of the process. So the agenda for reform, we've got to talk about that. We have very little quantitative information, size, shape, and scope studies, as we call it. We don't do any inspections because the inspections are covered by legal instruments. The Department of Labor has to go to formal workplaces, registered workplaces. The local government environmental health officers goes to registered workplaces. So there's no inspections. And the key area is Murray sits also on a very important committee that completed its work called the social determinants of health. So with the informal workers, there's a very little overlap between work and home, because often they do these things together in the backyards, like spray painting of cars. So it's done in the backyard of the house. So the whole issue around the social determinants of health about water, sanitation, housing will also have an overlap in terms of the issues that face the workers in terms of the work that they do. Social determinants of health. It's a survivalist mode, so there's very little knowledge of, even if people have knowledge of the hazards, the solvents or the electrical, the pipeline issues that we have with the electricity connections, etc. But there's very little they can do about it. So they say, well, let me take my chance and actually continue with that issue. And we have very few models in the world. In general, we've done work. I mean, the Brazilian model, the Thailand model are very important models. But for Africa and sub-Saharan Africa, there's very few models in terms of what are the interventions we should be doing in terms of actually supporting the informal sector and the informal economy. So we're learning a lot more from WeGo, which is actually generating a lot of the data on the ground in terms of putting these things together. So the occupational problems are a combination of both health problems and occupational health problems. So the living conditions that people work in. So malaria and TB and diarrheal diseases, etc., and poor nutrition is also affecting the fact of the workplace. And then there's a range of issues on the working conditions that they face would be any typical work site. So studies elsewhere, long hours of work, because it's own account workers. So the longer you work, the more income you can generate, the $2 of making the 10,000 kites or whatever it is. So if you can make 11,000 kites, maybe you can go to $2.20 or something. No maintenance, so like generators, power, gas stoves. A lot of them are trading food, for example. So there's very little maintenance. And in fact, the week that we visited in Durban, there was a stove explosion where workers had been cooking and had actually had some burns and things. Personal protection, non-existent. So the Thailand model is very important for what they've done from local government to provide personal protection to workers in home-based and cottage industries. So those are important lessons for us as we move forward. No system of collecting information, and lack of an organizational base for support, apart from the work that's being done by the self-employed women's group, some of the co-ops, etc. So as my grandmother used to say, it's never too late. So let's start with the first issue on the policy and regulatory reform. So one of the key areas that we're hoping that IOM, with its convening power, together with other colleagues that we will work with, is to begin to start looking at some of the issues on policy. I'll talk a bit about that. The surveillance system, we need the data so that we can begin to start providing some work beyond the anecdotal stuff. Anecdotes are important, blue ribbon panels are important, but you need actually some data that can begin to start providing that together. Organization and awareness, this meeting is an important one, and I hope that there will be steps after this, Patrick, into Congress. Because I know that, from some of the other panels I served on, there's a direct entry to start having line functions beyond the Rockefellers, Medtronics, and Path, and other foundations, etc. But I think that we need ultimately governments to support this. So I'm going to talk a bit more on the services, and then, very important, the informal sector is a very stimulating environment. Working with colleagues like the colleagues on the ground is just fascinating to talk to colleagues like the recyclers, the waste, colleagues working with waste. It's a very stimulating environment as opposed to the narrowness of an organized automotive plant, where there are unions and bureaucracies in the union movement and bureaucracies in management. With the informal workers, it's very interesting working in terms of the stimulating environment, the self-employed women's groups. So firstly, the policy dialogue. It has to start with the political party. So what we're doing in South Africa is that we've made sure that this is within the ruling party's framework in terms of its constitutional approaches to ruling South Africa. And that's the African National Congress. So you start with a policy party dialogue, whether it's the Democratic Party or, I don't know, the BJP. You have to start with the party, because parties determine how you can move forward. I know there's a military junta, so it's slightly different in Thailand for the time being. But maybe the generals will also take things forward in Thailand. And of course, Brazil, we heard about the movement, the coalition of left forces that she spoke about. So a line ministry in government, and I'm glad to say that I'm leading the work in South Africa for the Ministry of Health, and unfortunately that's why I couldn't come in yesterday, because we had an important meeting on Monday with the Minister and the Director General dealing with occupational health issues for the country. So you need a line ministry that will say, we'll put this together. So beyond the party policy, you need a delivery mechanism that can begin to put the frameworks in place. Standing committees are important. The congressional hearings that we have on Capitol Hill, the lobbies. So we hope that we also have to do that. So we have what are called standing committees and portfolio committees. And of course, it's very nice that Mirai sits actually in a National Health Commission advising the government of India. So you begin to start influencing government processes. And very important, nothing without us. The US is not United States. It's nothing without us. So we have to work with the informal sector workers, that they actually have a collective voice to actually say things together and come together. So it's nothing without us, for us. Okay, so I think that's an important rallying cry that we work with. I'm running out of time. There's different levels of intervention. Ivan knows the discussion we've had at the WHO, the International Labour Organization. These are important multilateral agencies. The United Nations, like we've done the Rio, the post-Agenda 21 debates. So let's start putting this into those agendas so that we can begin to start looking at the decent work, safe work agenda in a slightly different way. In our case, BRICS, Brazil, Russia, India, China, and South Africa. Russia is having some difficulties at the moment. I mean, unfortunately, we've had some of the tragedies over the last month. But these are different policy influencing places that we can work in as governments. Regional, the African Union, the Asian, SADC, Andean countries, and of course, you're learning from some of the experiences here, and I talked about the technical convening powers. I've yet to hear a trade union speak on behalf of the informal workers. So let's begin to start actually talking to them as well. The evidence base, size, shape, and scope studies are very important. We need to know how big, how large, what types of work the informal sector workers are working in. What is the contribution to GDP? I know definitely Francie and them have been working in South Africa to try and start having labor market statistics, to start collecting the contribution of informal workers to the GDP of a country, as opposed to just formal statistics. So begin to start influencing departments of economics, trade and industry. Risks and hazards and the interventions, building a knowledge base for the interventions. And we need some forum as a clearinghouse. And we haven't yet worked out what that clearinghouse is, that can actually hold a base for the Thailand innovation, the Brazilian innovations, the tools, what works, what does not work, Zambian experience, etc., and how we can put this into practice. How can we bring it up from a project to a program and scale up and expand, because often these things land up with projects, but we need to actually ultimately make them programmatic. Capacity building, very important. In a month's time, we'll do a training program in Malaysia for doctors that work with workers in the informal economy. So there's a group called ENROVE that's pulling together doctors in Asia that are sympathetic to the work of workers in the informal economy. But they need to be trained because they need to have some tools. So we're bringing them together for a week's training. And we need some other colleagues to come in, and of course, technical partners and champions. Derek Yak is here with the Vitality Institute, and we need to pull that together. So yes, surveillance. I just don't want surveillance to sit at information and knowledge. Another article in the New England Journal of Medicine. Another publication from the Institute of Medicine. It has to go to interventions. So it's data to interventions as opposed to data to knowledge. So we have to complete that loop in terms of the process. So definitions are very important. Is it workers in the informal economy, or is it workers in the informal sector? What does it mean for us? And these are very important issues to people in the ground, etc. Greater focus, thanks to IOM, use of models, and of course the collective will. So let me just quickly move on the last part. The networking strategy is very important. But ultimately, we had an activist strategy, which I worked on for a long time ago, of activists. But now we began to start looking at networking strategies. Means we sit around with workers, and we begin to start discussing agendas for change. So this was a very important thing that you can look at later on about horizontal approaches, local and regional. So we learn from each other and work at networking theories. Promoting safety, health, and environment. This is more around the social determinants of health. It only doesn't deal with the work in ExxonMobil, but starts looking beyond ExxonMobil's territory. So we begin to start looking outside the workplace, nutrition, support, poverty, housing, etc., etc. So the wider issue about how do we working with ex-workers and communities. Universal coverage, we are introducing national health insurance, Obamacare for South Africa, as my minister calls it, because he says he can't talk about Cuba and some of these other places. So he'll talk about Obamacare and Segura Popular, you know, the Mexican model. Because if he says about Cuba or Brazil, then they'll say, it's the communists again. So he says, no, but it's Obamacare, you know. It's in a capitalist country. We're introducing universal coverage. And Obama, we are learning from Obama, you see. So this is the model. We have a national health insurance model over the next 15 years, started last year as the first pilot models. So we're looking at how we finance the model, and then part of that is the discussions like the Thailand about the packages and then the financing models as we go forward. So we're working on a WHO healthy workplace model, which looks at the wider circumstances beyond the workplace in terms of the delivery systems. These are typical occupational health services in any textbook of occupational health called prevention, promotion, curative, rehabilitation, and compensation. There's a model about how we build them up from starting small. We don't have to hit, you know, with high-level occupational medicine doctors and national institutes. We can start with ward-based community health workers to recognize work-related problems. So we're starting with that grouping in South Africa and primary healthcare nurses. And that was a workshop that Ivan and myself hosted 3 weeks ago in South Africa on how we begin to retool the primary healthcare system to help with occupational health. So this is the model for South Africa, similar to the Thailand model of, so we all have similar experiences in terms of learning from each other, the district health system, specialist hospitals, and then central hospitals. And the model over time is actually to build on academic reference units and working with primary healthcare nurses on the ground. So this is the approach we're taking. We will recognize work-related problems, working with what are called family medicine doctors in occupational health, and ultimately specialist medical practitioners. So nurses and community health workers are very important, but then we are building up technical skills like occupational hygiene, etc. Leslie is at the back here from NIOSH, and we're working very closely with her on a curriculum for the primary healthcare workers, which Leslie helped to develop with a colleague of mine in South Africa, Ina Naik, and they're going to start rolling out that program for the training of primary healthcare nurses in occupational health. All right, so in 1999, the ILO spoke about the decent work agenda, that each woman and man obtains decent and productive work in conditions of freedom, equity, security, and human dignity. We've got freedom, we've got human dignity in South Africa. Equity is still a long way to go. We're hoping to still make some changes on that. Security is still problematic because of crime and other issues, but at least we've got 2 of the 4. That's freedom and human dignity in our lifetime. In 2012, earlier this year, there were a whole lot of mine workers, because as they get shed from the formal mining industry, they get into the illegal mining. And unfortunately, 22 of them did not make it. So their bodies were retrieved. This was in March this year. So 22 of them shed from the formal mining economy, went underground and died in a gas explosion underground. So this is the reality of life. In 2012, the ILO said that decent work must be safe work. Thank you very much.
Thank you, Barry. That was incredibly, far-reaching and really brought forward the true issues that are on the ground and some of the gaps that are left based on how we define who workers are and the systems that are there to reach them. Do we have any initial questions that we can offer for Barry? Derek, please.
Yeah, thanks, Barry. Really excellent overview there. Just to go to the question of metrics, because I think you highlighted just how important it is to get the numbers right. And I think a group like this could very well lever access to sources that often the public sector don't have easier access to. So I'm thinking about the fact that groups like Nielsen and Euromonitor actually do have information on some aspects of the informal sector. It's often costly to extract it, but I think that if it was done through the IOM, we may very well be able to persuade them to do something on a pro bono basis, given that it will be a public service effort. I used the data to look at informal sector, food workers, food production, and to understand the size of it. And yes, there were limitations from Euromonitor and Nielsen, but they and others would have commercially available data, which is used extensively by Unilever or any consumer products company who go out and need to distribute their stuff. And then the second is, in many countries, the national census, often tough to get the analysis out of the national census, many parts of the world. But actually in the national census, there's often also data that if we have skilled analysts, we can extract.
Great, good, thank you. Any other questions from the group? All right, well then let's move on to Mirai. Oh.
As I mentioned yesterday, we've had a dedicated program on getting better data on the informal economy for 17 years, headed by somebody who worked with UN Statistics Division. And there's 2 or 3 problems that I think influential groups can help with, which is that the funders and the donors, they have their flavor of the month surveys that they like. So the World Bank likes a multi-purpose living standard measurement survey so that they have enough variables that they can compare and contrast and do the sort of economic analysis they like to. That does not give us sufficient data on employment. And there are fewer and fewer countries getting funding for labor force surveys, right? So that's one problem. We really have to stick to labor force surveys. Otherwise, we won't know which workers have better health, better incomes. The other is that many countries have delinked income expenditure in labor force surveys, so we don't get the variables that the economists like to crunch together in one. So we do need technical work dedicated to figuring out how to get the samples linked so that we're not doing sort of just proxy estimations. And I think we could have a really good working group, but I think it needs to happen through the national statistical systems and the UN statistical system. But it's a plea to anyone who has influence over funders that we do need better labor force surveys, and we need to be able to link them. And we've had somebody do a methodological study for us, somebody, ex-ILO statistician. So it's a serious technical issue, it's a political issue, it's a financial issue, but we need better labor force surveys and the ability to link them.
Great. Thanks, Marty. Quick question over here, and then over to you, Kevin.
Well, this just kind of another comment to put on the table in response to Derek and Marty's comment. So Mariah and I were chatting this morning, and one thought that kind of came out to me from the earlier discussions in this meeting is this point that Marty raised about the linkages between formal employers and informal workers who might be further down in the supply chain or in the distribution chain or whatever. And that made me think that other than the kinds of data that surveys collect, maybe there's an opportunity for larger formal sector employers to actually develop a diagnostic and a methodology to fully map out those linkages. Now, I can imagine that in some cases employers might not want to know all that information, but it seems to me that they have a particular ability to do that in a way that is not possible with survey data, because survey data does not allow you to explore those vertical connections. So that would be another way to look at the problem, not only from the survey and the general population information, but through actual networking linkages, how people are associated through networks of employment, formal and informal, and so on.
Right. And I just wanted to tag along with one comment, and very great presentation. I appreciate that. Obviously, data is very, very interesting to us. Barry, one of the comments that you made that really jumped out at me is data for intervention, not data for knowledge. And that's something that I appreciate that, because that's the call to action. That's to actually do something. And in fact, in my work, I have a common phrase that I use quite often, and that is, information without the ability to intervene is only interesting. So I really appreciate that. Obviously, there's a thirst in this room for data, but I appreciate your call to, let's do something with the data.